In a state-of-the-art operating room, a patient lies unconscious, ready for a craniotomy. Overhead surgical lights cast a sterile glow on the attentive surgical team. The surgeon begins the delicate operation with a precise incision, revealing the skull beneath. The neurosurgical drill whirs, creating burr holes in the skull as sparks fly. The craniotomy cuts between the burr holes, the blade humming. The bone flap is lifted off, revealing the brain beneath. In the tense atmosphere of the operating room, the surgeon delicately incises, revealing the brain tissue beneath. The dura mater is opened and reflected, revealing the underlying brain tissue. Extreme care is taken to protect vascular and cortical structures. In the sterile expanse of the operating room, the neurosurgeon peers through a surgical microscope, his focus absolute. Microinstruments dance meticulously around the soft brain tumor, suction, and bipolar cautery in delicate play. Fine sutures close the dura after the tumor is removed. Titanium plates secure the repositioned bone flap. The scalp closes, layer by layer. In the hushed atmosphere of the recovery room, a patient lies still, life measured by the silent dance of blinking lights. A nurse watches over the patient, her focused gaze seeking any subtle shift in the silent symphony of the machines. The animation studio is quiet as the screen illuminates, displaying craniotomy procedure summary. Craniotomy is a life-saving and delicate procedure requiring precision, planning, and post-op care. Subscribe for more 3D surgical tutorials.